Once oversight appears, stop optimizing for autonomy. That goal no longer applies. The rule is simple. Optimize for decision usefulness, not independence. That's the shift. And everything you do after oversight appears either reinforces that shift or quietly works against you. Let's get straight into what that means in practice. Once oversight is in place, your job is no longer to show that you can operate alone. Your job is to produce decisions that are immediately usable by leadership. That means you stop sending exploratory updates, you stop narrating thinking, and you stop surfacing open-ended option sets. Instead, you do three things consistently. You pre-narrow, you recommend, and you frame outcomes, not activity. Every update answers one core question. If leadership does nothing after reading this, does work still move forward? If the answer is no, the decision is not usable yet. Oversight exists because uncertainty became expensive. Not confusing, not annoying, but expensive. Under oversight, leadership is not trying to understand your thinking. They're trying to reduce risk exposure. Exploratory communication increases perceived risk because it forces interpretation. Interpretation shifts accountability upward. When leadership has to decide what you meant, oversight tightens, not because they distrust you, but because the system now requires it. Decision usefulness removes that burden. It tells leadership, this has been narrowed. This has been judged. This can move without intervention. That's what stabilizes authority. Here's what this looks like in a normal project management environment. You're asked for a status update on a decision that still has uncertainty. The old instinct under oversight says, we're evaluating a few approaches, or there are trade-offs, or we're still learning. While that feels safe, it's also the fastest way to lose ground. Instead, you do this. You lead with a decision. You say things like, we are proceeding with option B, or option A was eliminated due to delivery risk, or option C was eliminated due to downstream maintenance cost. Here's what we're monitoring post-decision. Notice what's missing. No brainstorming, no live thinking, no invitation to interpret or reinterpret. You're not hiding uncertainty. You're containing it. And that's the difference. You also standardize how decisions show up. Every update follows the same internal structure. Decision, rationale, impact, and next checkpoint. When leadership knows exactly how to read your updates, they stop needing to supervise them. And that's how oversight loosens, quietly. Most project managers keep trying to earn autonomy by being more transparent. They add context, they add detail, they add optionality. They think clarity builds trust. However, clarity without judgment feels like risk deferral. Leadership doesn't think, they're thinking deeply. They think, why hasn't this been narrowed yet? That's when authority erodes. This matters even more in healthcare IT or healthcare informatics, especially during electronic medical record implementations or EMR implementations. And this is something I've seen repeatedly in real EMR work. In an EMR or EHR implementation, uncertainty isn't just operational, it's clinical, it's compliance related, it's patient impacting. So oversight shows up fast. Clinical leadership does not want exploration in updates. They want containment. Let's say you're managing an EMR rollout and there's an unresolved workflow issue between nursing documentation and physician order entry. The old project manager instinct says something like, we're exploring a few configurations, or we're testing workflows, or we'll bring options next week. That may sound reasonable, but in an EMR context, it creates alarm because leadership hears this is unresolved and it could affect care delivery. Here's how decision usefulness looks instead. You say, we are implementing workflow B for go live, or workflow A increases training burden for nursing, or workflow C creates downstream reporting risk, or even we'll reassess optimization after stabilization. Now that update does three things. It protects clinical confidence, it reduces escalation, and it signals control. You're still managing uncertainty, you're just not exporting it upward. In EMR work, that distinction is critical. It's also why project managers' authority either stabilizes or disappears entirely during implementations. I'm sorry, I had to give that example because that is my realm of expertise as a project manager. Now, once oversight appears, stop sending open option sets. Stop explaining thinking without judgment. Stop asking leadership to choose between unfinished paths, and stop reframing progress as activity instead of resolution. Those behaviors feel collaborative. Under oversight, they read as unresolved risk. Every decision you communicate must pass this test. Can this move forward without further interpretation? If yes, send it. If no, narrow again. That's the rule. Once oversight appears, autonomy is no longer the goal. Decision usefulness is. If you optimize for that consistency, authority stables, even in high-risk environments like an EMR implementation. In the next video, we'll talk about why exploratory updates, even smart ones, often backfire once oversight is in place, and what to do instead.